So I hope you're all doing good, and I hope you've all started using my tips and techniques, and you've started brushing the right way. Yeah, so let's begin. We have some people joining in. So last week I talked about why brushing is important, what is the brushing technique that we should be using, and everything about toothbrushes. So I hope you're doing, you've selected your toothbrush the right way and you are brushing the correct way. Okay. So today we will start with, I will be talking about toothpaste, flossing, very important, and mouthwashes. So a lot of people ask me which toothpaste is good or which brand is good. There are so many brands available in the market. So it's a little bit difficult to select the right toothpaste. So here I'm going to give you some tips on how you're going to select the toothpaste. I will not name a particular brand or so, but you can make your own decisions by listening to this information that I'm giving you. See, every individual has their own needs. Okay, some person may have sensitive teeth, so they may have to select desensitizing toothpaste. Some people may want brighter and whiter teeth, so whitening toothpaste are best for them. Okay, so whatever the needs, the main ingredient to look out for in a toothpaste is fluoride. Fluoride protects the tooth enamel, it protects the tooth, it prevents dental decay. It slows down the breakdown of tooth enamel, which is caused by the acids produced by the bacteria. Last session I told you that the bacteria that are present in the mouth, they feed over the leftover feed and food, and they produce acids, and these acids slowly break down the enamel. So fluoride actually slows down this breakdown of enamel. It also takes up the minerals from and remineralizes the tooth. So it puts back the minerals back into the tooth. So it actually is very helpful, even reversing the initial cavities, the initial caries. So always look out for fluoride in a toothpaste. Okay, the fluoride that should be there in the toothpaste should be at least 1000 parts per million. Okay, so you can see it on the cover, just below the ingredients. You will see the concentration, how much of fluoride is present. It could be either in the form of sodium fluoride or stannous fluoride. Okay, so always look out for fluoride content in a toothpaste. Next, coming up to is people who have sensitivity. Okay, that means they have pain on biting or pain on having cold or hot food. Okay, that they have that jhanjanahat which comes in the TV commercials. Okay, so if a person is having sensitivity, the best toothpaste that you can use is a desensitizing toothpaste. Now these toothpastes have potassium nitrate or strontium chloride as their main ingredient. Actually, what happens in sensitivity? The tooth's second layer, okay, the first layer is enamel, the second layer is dentine. So the tooth's second layer has these very fine tubules, they call the microtubules, and inside these tubules there are the endings of the nerves. So whenever there is hot or cold, these nerves get overstimulated. So the desensitizing toothpaste that have strontium chloride and potassium nitrate, these compounds actually act as a shield over the nerve endings, thereby desensitizing the tooth. So people who have sensitivity, the best toothpaste that they can use is these desensitizing toothpaste. For example, you have many brands like Sensodyne, Sensodent, Thermosil, Colgate sensitive toothpaste. Okay, so look out for strontium chloride or potassium nitrate. For the fluoride containing toothpaste, again, many brands, Colgate, Pepsodent, Oral-B, for kids it's Cheerio, Kidodent, many are there. Okay, so now let's go to whitening toothpaste. So people who want nice, whiter, brighter teeth, okay, so they can opt for the whitening toothpaste. The main ingredient in these toothpastes are silica or calcium carbonate products. So what these particles do, what these compounds do is they actually remove all the external stains over the tooth. So जो कुछ भी stains बाहर से है, ये tooth whitening toothpaste से ये stains निकल जाएंगे. Okay. But remember that the stains that are there inside the tooth, internal stains or intrinsic stains as we call, these whitening toothpaste will not remove the intrinsic stains. Also, the natural tooth of the color will not change with whitening toothpaste. The natural color will only change with a bleaching treatment. Okay, so you would not get a very drastic difference with whitening toothpaste. One more disadvantage with whitening toothpaste is that, like I said, these calcium carbonate and silica, these particles are a little coarse, so they are more abrasive in nature. By abrasive, I mean to say that they actually rub against the tooth, and thereby they will thin out the enamel. Okay, the outermost layer of the tooth, they will thin out the enamel. And once the enamel is thinned out, the second layer, dentine, is exposed. And like I told you, dentine has nerve endings in it, and so you may have sensitivity or yellowing of the teeth. So I will not recommend whitening toothpaste to be used for a very long period of time. For a short period, yes, you can use whitening toothpaste. Now coming up to tartar control toothpaste. There are tartar control toothpaste. What is tartar? Last time I told you about plaque. Okay, so plaque when gets hardened up, it is called tartar. Okay, so if you do not brush your teeth for say almost 2 days, the plaque that is there, that will get converted into tartar. So tartar containing toothpaste, they have zinc salts and sodium pyrophosphate as their main active ingredients. So these compounds, they prevent the formation of tartar. I am repeating, these compounds prevent the formation of tartar. Okay, so once tartar, just remember that once tartar has been formed, these toothpaste will not remove that. Okay, you will have to visit a dentist to get it removed. The dentist will do a thorough cleaning of your teeth, by which the tartar will get removed. So these toothpaste are only to prevent, they are preventive, they are not therapeutic. Okay, remember that. So people who are very prone to getting tartar can use these tartar controlling toothpaste. Now the next one is the charcoal toothpaste. Charcoal is so much in, it's so trendy nowadays. You know, they've started putting charcoal in face masks, scrubs, and now with into toothpaste also. Okay, so charcoal toothpaste are good enough. They will remove all the external stains again, but there are some disadvantages again to it. Charcoal being coarse, okay, the particle size being coarse, they are going to again abrade the tooth, just like the whitening toothpaste. Okay, they will wear out the outer enamel, and this will cause sensitivity and yellowing of the teeth. Okay, also in older teeth, you know, there could be some fine cracks or crevices inside the tooth, you know, those small markings inside the tooth. So these charcoal toothpastes, what happens is the charcoal gets embedded into these cracks and crevices, and this will again lead to staining of teeth. Okay, so charcoal toothpaste not really very effective, because most of them do not have fluoride also into them. So for a very short period of time, yes, you can use charcoal toothpaste, but not for a long period of time, because again it's going to cause sensitivity and staining of your teeth. Coming to tooth powders. Okay, tooth powders are as effective as toothpaste in removing the plaque, but again tooth powders are coarse. Okay, their particle size is larger. Okay, in fact, if you take some tooth powder, you yourself will feel, you can see the difference between a toothpaste and a tooth powder. Toothpaste is very fine, tooth powder is a little coarse. So when you rub the tooth powder against your tooth, it's going to remove the enamel of your tooth, and again it will lead to sensitivity. Okay, so I usually do not recommend tooth powders. The best is toothpaste. Now one of the viewers had asked me a question on which toothpaste should a diabetic person use. See, fortunately, none of the toothpaste are going to have a direct effect on diabetes or direct effect on the blood sugar levels. None of the toothpaste are going to spike up the blood sugar levels. Okay, so any of the toothpaste can be used, but we must take into consideration, see, diabetic patients are more prone to having gum diseases. Okay, so because gum diseases now will be caused by plaque and tartar, they can switch to tartar controlled toothpaste or any fluoride containing toothpaste. Okay, both of them are good enough to go. So no particular toothpaste for diabetic patients, but yes, any of them, fluoride or tartar controlled toothpaste, because they are more prone to having gum diseases, right? So we have so many TV commercials, you know. I just remembered one of my cousin who used to always joke around whenever he would come to meet me. The first thing he would say is, "Kya आपके toothpaste में नमक है?" Right? So all this namak, neem, and salt, so many other things that are being added, clove, all these does not make much of a difference. Okay, the main thing that you should be seeing in a toothpaste is fluoride. Okay, so rest all whatever comes are they're just like a bonus. They just like to enhance your taste and enhance the feel of the toothpaste. So क्या आपके टूथपेस्ट में नमक है? You should be saying क्या आपके टूथपेस्ट में fluoride है, right? So now how much of toothpaste should you use? Okay, from 0 to 3 years of age, use just a thin smear, okay, thin layer, thin smear of toothpaste, or just the size of a rice grain. And about 3 years old, you can use the size of a pea. जो मटर का दाना रहता है उसी साइज का टूथपेस्ट लेना. You don't need to take that entire rope. वो पूरा टूथब्रश का हैंडल टूथपेस्ट से नहीं भरना है. Okay, that's just waste of your toothpaste, waste of your money. Okay, so just a pea-sized amount of toothpaste is enough. And then brush with the technique that I have said. I have told you the last session. See, having said all this, having said about all this about the toothpaste, what is more important is the way you brush your teeth. You can use any toothpaste, but the brushing technique is to be taken into consideration. So it's like, you know, you can use any soap, but the way you scrub your body and keep it clean, that is more important. Okay, so follow the brushing technique, focus on the brushing technique, and of course your toothpaste is there, but shouldn't make a fuss over which toothpaste to use. Okay, just check out for fluoride as the main ingredient, and according to your needs, if you have sensitive teeth, go on for desensitizing toothpaste. If you want whiter teeth, go in for whitening toothpaste, but it wouldn't make too much of a difference, whitening toothpaste. You can go in for tartar control if you're more prone to having tartar, so tartar control toothpaste. Okay, so this is all about toothpaste.